It seems more and more hospitals are pressing pause on their elective surgeries in order to free up beds for patients who are seriously ill. Ariel Placencia has been looking into this. Ariel, walk us through what's happening here.
Well, Chris, I'll start with the governor because remember at the beginning of this month, he issued a proclamation suspending all elective surgeries in hospitals across a handful of Texas counties. And Dallas County is the only North Texas county that he identified in that order. And here's what that proclamation from the governor actually says, that the governor directs all hospitals in these counties to postpone surgeries and procedures that are not immediately medically necessary. Now, Medical City announced that they've temporarily suspended elective surgeries starting yesterday, and it's going to be that way until July 27th. They said they did it to, quote, enable them to safely and quickly expand capacity and staff to care for hospitalized patients. Meanwhile, Texas Health told me that last week they actually paused the scheduling of non-urgent elective surgeries and procedures that require a hospital stay. Now, I should say that procedures that have already been scheduled, those are going to continue at this time, I'm told. Now, they do anticipate resuming the scheduling of these elective inpatient surgeries on July 27th, and then those surgeries themselves, they're going to start on August 3rd. And JPS in Fort Worth told me today that they've actually made some adjustments as well. The elective surgeries that are currently being formed at JPS are those that do not typically require a hospital stay. And finally, Baylor Scott and White Health, as well as Methodist Health and UT Southwestern, they told me today that they have not suspended any elective surgeries, nor have they scaled them back. But of course, they're keeping a close eye on everything that's going on. Izzy?